Welcome to your pre-op teaching video for your upcoming facelift surgery. Before your pre-op appointment, make sure if you needed any medical clearance from either your physician or an ophthalmologist, that is in the works. This is not a surgery we like to do on people who smoke, vape, or use nicotine patches. If you had to gather up some old lab work or an EKG, get working on that, and be sure to read all of the paperwork from our office, especially your consent forms. 2 weeks prior to surgery, you want to stop all blood thinner medications and herbal supplements because those generally haven't been tested with anesthesia. Common over-the-counter blood thinners include aspirin, ibuprofen, fish oil, and vitamin E. You also want to reduce your alcohol consumption. I would recommend cutting back to no more than 1 drink a week, and if you're going to be really good, don't drink at all a week before or after your surgery. Review the teaching materials and create a question list that you can bring with you so we can specifically address what's still not clear to you. These are a bunch of medications that are great to have around, and you might already have them in your house. So Tylenol, which will be one of the mainstay medications we use for pain, Dramamine or Bonine that are used for motion sickness and nausea, have some antacids like Tums or Pepcid, and some antihistamines like Zyrtec, Claritin, and Benadryl. We will give you a bottle of this homeopathic medication called Arnica Forte, and it contains arnica and bromelain that help to speed healing and reduce bruising and swelling. Now, the bromelain contains pineapple and papaya, and these pills contain a trace of wheat. So if you have any food allergies to these, you may want to skip it. You start this the night before surgery, and you'll continue it twice a day until it's gone. You can also get arnica in gel form and arnica and bromelain separately at the health food store. So you'll definitely be using Tylenol or acetaminophen after your surgery to help with pain. It's good to know that it comes in 2 different strengths. Regular is 325 and extra strength is 500 milligrams. Our recommendation is to take 1,000 milligrams 3 times a day for at least the first few days after surgery so that you have a good baseline pain control. It's also very important to know that you should never take more than 4,000 milligrams of Tylenol in a 24-hour period. That would be 8 extra strength Tylenol. So this is a medication we start the morning of surgery, taking 2 extra strength with a tiny sip of water before you leave for the hospital. At your pre-op, you'll also get your prescription medications, and these at some point, we may be able to electronically transfer to your pharmacy. So we will likely use an anti-inflammatory called Celebrex, a muscle relaxant called Valium, a narcotic painkiller, typically oxycodone, and then a prescription strength anti-nausea medication called Zofran. Celebrex or celecoxib is optional, but we do recommend if it's safe for you to use, it is really nice for helping with pain. I like to describe this as designer ibuprofen because each of these pills will last for a whole 24 hours and it has much less bleeding compared to other non-steroidals like Motrin or Aleve. And it's something that you would use only as needed. The dose that we recommend is based on your age and your kidney function. If you're under 65 and you have healthy kidneys, you can take this medicine twice a day, so it never really wears off. If you're over 65, we don't want you to take it more than once a day or once every 24 hours. So this is also a medication that we start the morning of surgery, taking 1 or 2 based on your age with a tiny sip of water before you leave for the hospital. Valium or diazepam is a muscle relaxant, and it also helps to treat anxiety, which is pretty nice after a facelift. You can take one of these every 6 hours as needed. Because Valium is also sedating, you want to stagger it with your pain medication. And honestly, you don't know if you need both every 4 hours, so you could start with one, and then a couple hours later, you take the other. You also never want to mix this with other medications that treat anxiety or sleep sleeping pills. So if you're on already Xanax or Ativan or Ambien or something like that, you would never take this in addition to those other medications. Also, I would not recommend that you use THC products if you're still taking your Valium. I don't know if you all remember that old Rolling Stones song, Mother's Little Helper. This tends to be everybody's favorite medication, but because it can be very addictive, it's one that we like to limit refills on. You'll also be prescribed a narcotic pain medication. Most commonly, we use oxycodone, which is the same painkiller found in Percocet. You can take one of these every 4 hours as needed, and it's actually okay for you to take two at a time if your pain is severe. You may have a different choice, like Ultram, which is weaker, Dilaudid that is stronger, and some people prefer something different like Norco, which used to be called Vicodin. Just as a reminder, that medication only comes with Tylenol in it, so you won't be taking Tylenol around the clock as we prescribed earlier. It's important to know that we cannot phone in narcotic refills, so if you're running low and it's getting close to a weekend, make sure you send someone in to pick up another prescription for you. It's actually pretty uncommon that people take their narcotics more than the first day unless it's at night to help them sleep. Now, remember that it's the patient who should decide if and when something like this is needed. The goals of pain control are to decrease moderate to severe pain down to something that's a lot more tolerable, but it's not that it should make you pain-free. And please don't take narcotics to help treat anxiety. Narcotics can have a lot of side effects, including nausea, oversedation, decreased respiratory drive, itchiness, constipation, and addiction. We will also be prescribing a prescription strength anti-nausea medication called Zofran ODT. And the ODT stands for oral dissolving tablet. So you just need to take one of these, place it under your tongue, and it will be absorbed. It can be used every 4 hours as needed. At the hospital, it's likely we might also use something called a scopolamine patch, and that looks like a little round Band-Aid that they'll put on your arm under a piece of sticky saran wrap. This works for 3 days, but it does have some side effects, including dry mouth, blurry vision, urine retention, and even confusion. So we typically won't use this in older patients because the side effects are more severe, and we usually don't use this in men. Now, once this is done working and you want to take it off, or if you've gone 24 hours and you're doing really great and you don't think you need it, be sure to wash the skin where it was on your skin with soap and water and wash your hands after handling it. And when you throw it away, make sure it's not in a place where a pet can get to it in the trash can. So remember that we also asked you to pick up either Dramamine or Bonine. The good thing about all these different anti-nausea medications, the Zofran, the scopolamine patch, and the Dramamine, is they can all be safely used together. So if you use one and you still have nausea and you're still uncomfortable, you can feel free to take another one to help treat that. This is another pretty cool device that you'll wake up with in the recovery room, and it'll be around your face, held in place with a little cord or an OR mask with elastics. It's called a soft pulse, and this creates an electromagnetic pulse that you can't hear, see, or feel, but it works to decrease pain and swelling. It has just a single on-off switch, and we want you wearing it pretty much round the clock 24/7 until the battery dies, which is at about a week or 10 days. And the only time you should probably take this off is when you're in a shower. So it looks pretty silly. It's kind of like your cone of shame that the veterinarian might put on, but it can really help get you looking better faster. The night before your surgery, it's important to understand your NPO orders. And what that means is the last time it's safe for you to eat or drink. So before an anesthetic, you should have no food or full liquids like milk or orange juice for 8 hours prior to your procedure. But it is safe and even advised for you to continue having clear liquids, things like water, Gatorade, apple juice, tea, black coffee, or clear jello until 4 hours prior to your surgery. So if your surgery starts first thing in the morning, it may seem really ridiculous to wake up at 3:30 in the morning to just drink some Gatorade. So I totally understand that. But if you're prone to migraines, it's not a bad idea to get your caffeine in and some sugar in when you can last safely do that. Also, the night prior to your surgery, it's good to start your Arnica Forte, so you would take 2 of those. Be sure to review your arrival time and place, review all of your instructions, and you may get a phone call from your anesthesiologist. On the morning of surgery, it's important to really, really clean your hair and your scalp and your face. So you should take a shower and wash your hair with an antibacterial soap, something like Dial. You can then follow this with your regular conditioner and don't use any styling products. We'll also give you a little package of Hibiclens soap, and that's fine to put on a washcloth and really scrub the area around your ears and in the front of your hairline. But be sure to don't get this in your eyes or in your mouth. If you have longer hair, bring some ponytail holders that you don't care about. And I would advise you to wear something easy to get in and out of that you don't have to pull over your head, something like a zip-up hoodie. Also, the morning of surgery, we're going to want you to take your pre-op medications with a tiny sip of water before you leave for the hospital. So that's typically going to be 2 extra strength Tylenol or 1,000 milligrams of Tylenol, a Dramamine or Meclizine, and 1 or 2 Celebrex tablets based on your age. If you're on other prescription medications at your pre-op appointment, we'll go over which of these are important to take the day of surgery and which are okay to skip. Be sure to bring your Arnica Forte with you in addition to your identification. And if you're on any unusual regular medications that might not be on formulary at the hospital, you could bring those. But please do not bring your Valium and your pain pills and all that stuff. Leave those at home. Those are for you to use afterwards. If you're staying overnight, it'll be on the 6 North Suites, which are really, really nice rooms. The nurses are going to be watching your blood pressure closely, treat your nausea, and treat your pain. It's in these first 24 hours that the risk of having a bleeding complication is high. And if you're retching and vomiting or doing too much, or your blood pressure is a little out of control, the nurses are going to be there to help you. I will likely take your drains out the next morning, but for some patients, I prefer to leave them until the first follow-up appointment, which is 4 days later. Most commonly, I will leave drains in men and people who had perhaps a little bit more work done on their neck. It's fine for you to shower the next day, and everything can get wet. These are the important things to remember if you're having a face or neck lift. You're going to have incisions in front and behind your ear and under your chin. And you'll go home from the hospital with a little antibiotic ointment tube that you can put on there 2 or 3 times a day. It's also fine after the first 48 hours. If you wanted to switch over to something like Aquaphor, that's fine as well. We really want to avoid anything that involves straining, heavy lifting. You don't want to bend forward if you drop something on the ground with your head pointing down. You want to do a deep knee bend. We're trying to do everything possible, if you think about it, to not make your face turn red, because that can increase bleeding. The position that you sleep in is also important. We wanted you to use a wedge, or you could use extra pillows, or maybe even sleep in a recliner to keep your head above your heart. And that soft travel pillow, some people do like using that behind their neck to just help position them so that their chin is up a little bit. Think of that angle, from your chin to your neck down to your chest. You want to try to keep that at about 90 degrees. So it's almost like you're slightly looking up. So if you're on your computer and you're looking down at your computer, that's actually not a good position for you. You want to put your computer up higher on something so that you're looking up. If you're on your device like an iPad or your phone, hold it up a little higher so you've got your head position just up slightly. Try to turn more at your waist and not at your neck. Those muscles that we sew together so tightly in the neck area, we don't want anything to really be working, so the more you can relax those, the better. As far as your diet goes, I would recommend trying to avoid really salty processed foods because that can increase your swelling. And also, if you can eat things that require minimal chewing, that will be more comfortable for you as well. Now, cold compresses are also a great way to treat pain and keep swelling down. And my favorite way to do that was to make a bowl of ice water and put a couple of washcloths in there. You can wring out one washcloth that's very cold and just lay it across your neck, or you can lay it across your face. You can just rotate these out as they start getting warm. You do have to be careful about avoiding any ice directly on your cheeks or on your neck because those areas are going to be pretty numb and you won't feel it if it's getting too cold. Remember to keep using your soft pulse, and our goals for your systolic blood pressure is to keep it below about 160 or 170. If you're having your eyelids done, which is called a blepharoplasty or a brow lift, and this could either be your upper eyelids or your lower eyelids, expect that you're going to see some bruising, some puffiness, some blurry vision. Those kinds of things are expected. Sometimes it's difficult after eyelid surgery to close your eyes all the way, so our goal is to not let your eyeballs dry out. You may be good at closing with a little bit of effort, but when people sleep at night, oftentimes their eyes aren't completely closed. So during the day, if you need to re-wet your eyes and you like to see, you can use something just like saline eye drops. But if you want something to last overnight, you need a thicker product. So they're typically eye gels like Genteel, Sustain, or Refresh, and you can put that in before bed, and that'll keep your eyes moist for a longer period of time. You can also repeat that if you wake up in the middle of the night. If you're having your upper eyelids or lower eyelids done, I will also give you at the hospital a little teeny tube of prescription eye ointment. So you can put this on the sutures on your upper eyelid and typically in your eye if we're doing your lower eyelids. The product that I use for lower eyelids has some antibiotics in it and also a little steroid. And that steroid helps to calm your eyeballs down because they're not so happy with what we just did. But it's also extremely important to know that you can't use that steroid ointment indefinitely in your eyes, and we recommend that you only use this for 1 week. You should continue to use cold compresses on your eyes as that'll help get the swelling down faster, and absolutely no contact lenses for at least 2 weeks. These are all things that are common and normal after having a facelift surgery. You'll definitely have some pain, and as I said earlier, most of that pain is going to be in the first 24 hours, and then it will get significantly better. Most people describe the pain in the central portion of their neck, straight down the center, and behind their ears. You'll also have bruising that will typically get a little bit worse over the first couple of days. The swelling is going to be pretty impressive, and you might not recognize yourself. The cold and elevation and avoiding salt will help that swelling go down. Eyes can be pretty darn puffy. Sometimes it's hard to even open them or see, and it's very common to have blurry vision because of the swelling and some of the ointments that we're using. You should probably expect a little asymmetry on your face. There are sometimes muscles that work a little harder on one side than the other, and you may be a little bit more swollen on one side that compared to the other. You'll also have numbness and tenderness that will change over time, and if you have other procedures like your eyelids or fat transfer, expect that you may have some bruising or swelling in those areas as well. Here are the things that concern us. A hematoma is what we're really trying to avoid. And again, the risk of that happening is most likely going to be in the first 24 hours. But I did have a patient who got a hematoma 8 days after surgery who wasn't really following their instructions. So a hematoma is when an artery bursts open. And so the blood fills up very quickly in the surgical site and it's under pressure. So the swelling is very very quick, and it may start either in the cheek or in the neck area and can rapidly spread to other areas, like maybe across to the other side. And because this pressure builds up, the area is very firm and it can look very, very bruised very quickly. So a hematoma is a surgical emergency. I need to see you right away. If it's something small, I may be able to take care of it in the office, or it may need to go back to the operating room. But this can be dangerous because it could press on your trachea or make it feel more difficult to breathe. So if this happens, you need to call me right away. It's not normal for somebody to develop a rash on their body after surgery like this. Now, you can get some itching from your narcotics, and narcotics can cause a rash, but what we really worry about is if you're having an allergic reaction to a different medication. So if you develop a full body rash or it's starting to spread, you want to stop all of your medications and talk to us. We would also want you to start those antihistamines like the Zyrtec or Claritin and Benadryl as soon as possible. Chest pain, shortness of breath, or persistent pain in one of your legs could be a sign of a blood clot, and that is also something that we would be very concerned about. It might be normal to have a temperature of around 99 or 100, but if it's creeping up to 101, give us a call so we can run through some questions and make sure that this is not an infection. Now, these are not emergencies, but something that you should let us know about during business hours. A seroma is a little bit of that fluid that was coming out of the drains that accumulates typically in the lowest area of your neck. When you touch it, it sort of has a little jiggly fluid wave to it. And typically when I've seen these, they're about the size of maybe the width of your finger, kind of running along the bottom part of the neck. Your body may just go ahead and resorb this, but it's easy for us to put a tiny needle in there and suck that fluid out. So if you see a seroma, just let us know during the next business day and we will get you in. If your blood pressure is still consistently bouncing around and running higher, it's not an emergency if it's around 170, but if it's over 200, you definitely should talk to your primary care as well as us. But if it's bouncing around, we may want to change some medications and involve your primary care. So let us know if you're walking around with really high blood pressure. Your primary care doesn't want that either. Driving is probably safe somewhere between 1 and 2 weeks. And the problem with driving is that we don't want you turning your head to look over your shoulders. Even if you have a backup camera, really safe driving includes the ability to look over your shoulder. You also should not be driving until you're off all of your narcotics and your Valium, and you should be able to see well. Your vision should be clear. So I'll leave it to you to use good judgment. I would say no one drives to their first follow-up appointment, and there may be some people who drive to their second. I personally did not drive for 10 days after my surgery and only went on short little drives at that point. Your reaction time may be a little slow, so just use good judgment when it comes to returning to driving. Your first follow-up appointment is going to be about 4 or 5 days after surgery, and we are going to take out those tiny blue stitches around your ears, underneath your chin, and if you had your upper eyelids done, we'll take out stitches in that area as well. If you want to be your nurse's best buddy, you can shower right before you come in, and don't put any antibiotic ointment or Aquaphor on your stitches so it's easier for them to see. We're going to also at this visit discuss your activities, which really will not have changed much, and provide reassurance because there's no doubt you will be concerned, as will your family members, about how you look. Your second follow-up is going to be about 1 week later. So that's going to be at about 11 days. At that visit, we'll take out any sutures you have in your scalp or any staples you have in your scalp. We'll also discuss starting scar care, which is safe to start at 2 weeks. And we recommend biocorneum, which is a silicone gel that you can rub in, and it has sunscreen in it. So that's a nice thing to be using long-term for at least the first 3 months after your surgery. surgery. That's a product that's used twice a day. We don't like scar creams and things on your eyes because it tends to be more irritating. So if you had your upper eyelids, we'll likely give you strips of silicone gel sheeting, which is a sticky rubber that you can put on your eyes when you sleep at night. Not only is it good for the scar, it actually helps to keep your eyes from drying out while you sleep. All right, congratulations. You are super prepared for your upcoming surgery. Again, remember to bring questions with you to your pre-op appointment so we can address what you still don't quite understand. This is really big. If you're having someone help you after surgery, whether it's a spouse or a loved one or a friend, make sure they watch this video too, because they'll feel very responsible for you, yet they won't get much teaching about what you might need. Be sure you take enough time to heal like you need to and to get rest. And please, please, please follow your instructions.